We are with Representative Lillian Ortiz-Self from the 21st District. So the budget was released, and there is a lot of things in there, but I want to ask you specifically about things that are really important to you. So let's talk about investments in schools. What do we have there?
I am very proud that we were able to release a budget that really prioritizes the needs of our communities. We've heard you across the board. Schools is a very important area that we heard from so many of you. And yes, we have funded in our budget behavioral health care, counselors, nurses, school psychologists. We have funded food nutritional programs, which were crucial during this time. We funded budget stabilization accounts and transportation to backfill areas where schools were operating in deficit. So we have invested in the COLAs for our teachers. All the areas that we've heard from you that are so critical. We know our schools have taken a big hit, and when our schools take a big hit, our students take a big hit.
So along the same lines, you did mention behavioral health in schools, but there are investments made in behavioral health outside of schools. So what about those?
Yes, we invest quite a bit in crisis and community outreach. We invest in opioid reduction, and we increase the Medicaid rate for our providers by 7%, which is something we've been hearing for years, that our providers need that increase in order to continue to serve our community. This budget addresses that.
I know that you are also very much involved in helping small businesses and the tourism industry as we hopefully come out of this pandemic. How about money there?
So we invest $200 million in the hospitality field. We invest by reducing liquor license fees for our restaurants. And in addition, we have a holiday sales tax for our small businesses that I think will give them some relief. And we also address the unemployment rates once again for our small businesses, things that we have heard from our small businesses that could really help make a difference for them.
And lastly, we got to touch on COVID. So what are we doing there?
We have $298 million across the state to continue to fill in the needs, from everything from supplies to staffing needs across the board. We also put in some supports for nursing retention and nurse recruitment, which we know is very needed. We have a shortage across the board, and our nurses have worked so hard. And so we try to address both the recruitment piece and the retention piece in our budget.
So we are at the last leg of this session. What do we expect for the next couple weeks?
We now have to pass all three of our budgets, our transportation, capital, and operating budget. We have been listening to Senate bills. Now the bills that have been heard on both sides will have to be passed by the opposite chamber, and our budgets have to be passed. So we're in our last leg. We are counting down the days, and hopefully we'll end with a significant assistance to our communities. You know, this has been a very fast, quick, in some ways crazy session because the needs are great. And we have heard from so many, and we've heard from so many of you in such a fast way. So thank you for making your voices heard. We know that there is an urgency to this session. And I think we operated this whole time with that urgency, and I think it's really going to bring some relief to our community.